I've been wanting to do this video for a while on information about periods, vaginas, because I think it's just a video that I'd want for my daughter. Hopefully other people find this helpful as well. And I asked in my story, when people got their first periods, did you know what it was? And although only 20% of people said that they didn't know what it was. That's still a jarring number though. A lot of people were replying saying yes, they knew what a period was, but when they got theirs, they thought it was shit because they didn't know that period blood can be brown. It's a mixture between cells of the lining of your uterus, blood obviously, and mucus. So that's why it has that sort of brown colour. The 3 books that I've read to prepare for this video, and also what I recommend for anyone with a vagina or uterus to read, knowledge is power, and a lot of times you're not going to find this information anywhere else. So you do need to educate yourself on it, unfortunately. Also, if you read the book Unwell Women, it talks about how women are basically gaslit in the medical industry. So if you go to your GP about pain, they'll prescribe you with a contraceptive pill or not take you seriously because women are seen as hysterical or we're making it up in our heads. Whereas women are statistically less likely to reach out for help when they're experiencing pain, and men are way more likely to. Especially for black women and women of colour, they're disproportionately neglected in medical practices, especially in cases of preeclampsia and pregnancy. So you do need to vouch for yourself, be able to speak up for yourself, or have someone to vouch for you, which is really disappointing. 3 books I'll be talking about is The Gynae Geek by Anita Mitra, The Vagina Bible by Jen Gunter. Jen Gunter does have a TikTok now though, but I remember I read that like 5 years ago, and I remember distinctly a bit in it about how nipple stimulation can cause early onset labour. That's why you're not supposed to harvest colostrum until you're like 37 weeks plus, because you can go into labour. So I remember when I was just over 40 weeks, I was like 40 plus. How many days did I go overdue? I think I went 5 days overdue. I was 40 plus 5, and I was trying to get, I was there fucking rubbing my nipples trying to go into labour. And then I read Vagina by Lynn Enright. And now the Vagina Bible was probably my favourite, and it's the most informative, and I just like her because she's funny. It's like it was an enjoyable book as well, if you get me. Best way to remove pubes. So in the Vagina Bible, Jen talks about how waxing and shaving can be harmful and cause a lot, like you'd be more susceptible to infection and other things. Like the pubes are there for a reason, to like protect the vagina. But I know for myself personally, this from my own personal experience, I find that if my pubes get a bit long, they can get like tangled in your underwear and get really uncomfortable and itchy. So what works best for me is that I trim them. It's different for everyone because depending on like the type of hair you have, what feels comfortable for you, because I don't have a lot of hair down there anyway, so it's not like difficult for me. You know, the hair is scarce, so it's not too hard. But I do remember, I have a vivid memory of me being pregnant trying to trim my pubes because they were so irritating and annoying, but I couldn't see because the fucking belly was in the way. So then I was asking Jason to do it and he wouldn't fucking do it for me either. So I just had to grow it out. So I don't even know what my vagina looked like when I was giving birth. But that's what works best for me. Now when I did shave, obviously in my early teens, like I remember when I first shaved, I was 13 years old. Now is that not disturbing? And I remember my mom in the shower was like, what the fuck? No, my mom wasn't in the shower with me, but I remember I was in the shower and we were the kind of family to like shower with the doors open, shit with the doors open. There was no locks on any of the doors. And she was like, what are you doing in there? Because I was taking ages. And I was like, I'm shaving. And she was like, what the fuck are you doing shaving? My mom never shaved. I've never known her to shave. Even if we were going on holidays, she wouldn't really shave. Loves a fake tan, loves a sunbed, but would never shave because we all just kind of have scarce hair. Like she probably has about 5 armpit hairs. I still don't have armpit hair on under one of my armpits, but I do in the other one. But I do remember shaving for the first time when I was 13, and I actually slit my finger because I didn't know how to do it properly, and I was like trying to get the hairs out of the razor. What was I thinking? Who was I trying to impress there? But it was obviously just an insecurity thing, or I was obsessed. I was yearning for womanhood and I wanted to feel mature, so I think that's why I was doing it. But I do know from watching YouTube videos when I was 13, I remember, and from talking to my friends as well, that you're supposed to shave in the direction your hair is growing to prevent ingrown hairs. So you shave downwards rather than, I know shaving upwards gets a better shave and you get like a more of a bald look, but that's how you create ingrown hairs and the razor bumps. So you're supposed to actually shave downwards. Say this is your vag, this is the vulva, right? This is the mons pubis, the fatty bit with the hair on it. You're supposed to shave downwards, not up, down, right? This is what I did because sometimes the down doesn't work. You kind of just go with slanty. If I tried to shave now, I don't think I'd know what I was doing. I shaved once after I gave birth, like to try make myself feel a bit better. I'm so grateful for my healed vagina right now because it was horrible. But yeah, I just went a bit diagonal to get in, and then, you know, stretch the skin between the leg and the crotch to get in between there. Now when it gets to actually your labia majora down a bit, like in the gooch, the perineum area, it gets a bit scary. It gets a bit scary down there. I would really recommend using a mirror. Don't go in there blind because you can cause injury. But yeah, Jen Gunter just recommends trimming, which is what I do now, and it's the perfect like in between for me. I just use a clean sterile scissors is what I use. Now that could be a bit rogue, but that's what I use. It's the truth. When I was shaving my vag, what I would do is, if I was doing it in the shower, I would do then a spurt of really cold water to close the pores. This doesn't work for everyone because I know coconut oil can clog your pores, so obviously be careful if this happens, but I found coconut oil was the best, simplest oil to have to put down there after shaving. I did used to use coconut oil to shave, but then my mom told me that it clogs the drains, so I stopped using coconut oil and I would use conditioner and like hair conditioner instead, or if I didn't have coconut oil I would use baby oil. So this is my copy of the Vagina Bible. It's gone like yellow because I've had it for so long. If you're dealing with any of these issues, this is what she has information on. So the vulva of the vagina, vaginas and vulvas in transition. So she talks about if anyone's transitioning, if anyone's transgender, she has a bit on that. Female pleasure and sex ed, pregnancy and childbirth, medical maintenance, food and vaginal health. She was debunking the myth that if you eat loads of pineapple, it changes the taste of your vagina. That literally is not possible and can't happen. But some foods can affect the pH level, and drinking alcohol can affect the pH levels of your vagina, as well as smoking can affect the pH levels of your vagina and increase the likelihood of you getting bacterial vaginosis, which was a huge issue that people were texting in. And then she said the bottom line on underwear, and you'll notice when you become a parent and you're buying underwear for your children, when you buy underwear for girls, they'll have this on the trim of the gusset, there'll be frills, and I remember distinctly as a child being so uncomfortable every time I wore underwear, and they'd be really tight around the legs and really tight around the hips, but so loose in the bum. Cut of them was way shorter, so they'd always be riding up your bum and riding up there and giving you a wedgie. I think I had a wedgie for my whole childhood, and that's why I moved so quickly to thongs, because I was so sick of fucking underwears riding up my arse. I would just prefer have it ridden up my arse the whole day instead of picking it out. And also the front wedgies are so fucking uncomfortable, and you'd be going around picking at your fucking vag all day. The lowdown on lube, Kegel exercises, pelvic floor exercises are probably the most important thing for your vaginal health, and you can do them at any point of the day. You could be sitting at your desk fucking squeezing away and no one would even know, but they're the best things that I found for the healing of my vagina. If anyone is about to give birth or has given birth, even if you get an episiotomy or not, like I got a forceps delivery, which is illegal in some countries because it is so dangerous and causes so many complications. Just be prepared. We're so overrun in maternity hospitals at the moment. Unnecessary intervention sometimes just happens. It's very common. It's unfortunate, but it's something you just have to prepare for. If you get an episiotomy or a forceps delivery, the best thing for your healing. Now, I thought that, I remember when the midwife came to my cubicle in the labour ward, I was like, surely I'm not doing the Kegel exercises until like my scars healed, and she was like, no, you should probably start them now. With the cut. No, I don't know how I went through that. I should have been I know I did complain about it, but I think I deserve to be complaining a lot more than I did. So to start the Kegel exercises as soon as possible and to try, it was really hard for me now when I was pregnant, because when you are pregnant, your pelvic floor muscle basically stretches out. So because it's stretched out, it's weaker. But if you have a strong pelvic floor, the easier it is to give birth. You can get this app, I remember. I'll link it down below if I remember, but it basically notifies you, it sends you a little thing on your phone being like, okay, hold for 5, loose for 5, hold for 5, kind of like breathing exercises but for your vagina. She has a whole bit on skincare and cleansing, so vulvar cleansing soaps, cleansers and wipes, which are a big no-no. When you look up information about thrush or BV, the huge thing is do not douche and do not use any products down in your vagina. You do not need anything to clean your vulva other than water, and you don't need to put water up in your vagina. Now obviously your vulva and your vagina are two different things. Why it's such a big issue that we only call it a vagina, because it's reducing women down to just they're reducing women's sexuality down to just a hole, even though our genitals are literally called the vulva and the vagina is just the whole part. Hair removal and grooming, moisturizers, barriers and bath products. Jen Gunter does recommend coconut oil. This is a doctor that's recommended these things as well, because I know that it's a huge issue about, you know, the internet and misinformation. That's why I just reference books, but I'm also talking about my own experience, so I will give a disclaimer every time I'm saying something that's just off my own back. Then she talks about menstrual products and mythology. The truth about toxic shock syndrome. Are there toxins in tampons and pads? And menstrual hygiene. The huge bit on menopause and treating GSM. Medications and interventions, so there's a bit on cannabis, contraception, antibiotics and probiotics, cosmetic procedures, injections and rejuvenations. The fastest growing cosmetic procedure is a labioplasty. People changing how their fucking vagina looks, chopping off their lips. It's disturbing. If it makes anyone feel better, because I know I had a few people texting in saying that they feel insecure about their vagina. I remember noticing it, and it probably only, because I remember your vagina, obviously it ages the same way your body ages. And you know the way your face is asymmetrical from, sleeping on one side more than the other. My mom told me that when I was a baby, the safe sleep regulations were different to obviously what they are now. Now it's like on their back, dodie in their mouth, and the foot to the bottom of the crib. Whereas my mom said that when I was a baby, the safe sleep thing was to keep the baby on the side, which makes, I don't know if that was true or not, but that's what she's told me. So you can tell that I obviously slept more, and whatever way they put me into the crib, that I slept more on this side, because my eyebrow is raised a bit more and my face is just a bit more smushed on one side. But I kind of like that about myself, because it's like, oh, my little baby face was getting molded. The same thing with your vulva. One of my labia minoras is way bigger than the other, and I remember figuring it out when I was probably 18, 19, because I wasn't huge. Like, I wasn't examining my body every single day, but then I remember like feeling around down there and I was like, Jesus fucking Christ. And it's stretchy. You know the way your neck's real stretchy? The labia minora are so stretchy, so I was like, Jesus Christ, I could almost reach my fucking knees. So if it makes anyone feel better, one of my lips is like way longer than the other. Obviously it's not that noticeable, but I can stretch it out way longer than the other. And the way it connects to the clit is also, they're both different. But I remember being insecure about it, but then because I thought that was like abnormal, I literally thought I was deformed when I figured that out. I was like, oh my fucking God, there's something wrong with my vagina. It's abnormal if my vagina was perfectly symmetrical. Like, that's a rarity. Everyone's vulva and vagina is different. On the insecurity about your labia, I'm gonna show you a diagram to begin with, because I feel like I didn't really know properly the bits of the vag until I saw this. You can screenshot there. Is it focused? I don't know. I think it is. But I didn't even know what the perineum was. I always just called it the gooch until I gave birth, because they were like, oh yeah, we've made a big laceration down your perineum. When I was insecure about the look of my vagina, it was actually when I was really young. And you know when you're in a mixed school and boys start talking about sex and talk not directly about you, but they start talking about girls, what's that word? When they start objectifying women, when you're a young child or teenager, like the earliest I can remember is probably 10 or 11, and they're slagging like ham sandwich vaginas, like flaps, talking about flaps hanging out and all this shite, when obviously all the information they're getting is from the internet, and it's just not realistic. And I only figured out and learned to accept my body when I started actually watching porn myself, because you're not going over to your friend's house and you're like, get your fucking flaps out so we can compare. Whereas like lads on the other hand are measuring their willies on sleepovers, and girls are just fucking normal. That's why I think it's harder for women and people with vulvas to know what's normal and what isn't. We're listening to boys being like, yeah, your flaps, has our flaps out and all. So that's why I felt so insecure. I thought that I'd had to have like a really neat, sort of fucking perfectly shaved, snatched vag with nothing, nothing hanging out. Which is barely any vaginas look like that. And the only vagina that does look like that is a child's. The shaven look, neat look, is literally pandering to pedophilia. Once you actually get into it and realise that it's so disturbing that that's what we feel pressured to look like. It's literally a fucking baby that we're forced to want to look like. Once I started watching porn myself, a huge help for that has been Cheeks. They've been so supportive of my channel and the reason I can keep making these videos. But they're a sexual wellness platform where there's educational videos on there, there's workshops, there's erotic audio stories, adult films. The platform also has a focus on diversity and inclusivity, so there's something on there for everyone. When you're comparing yourself to bodies, it's like, oh, I feel better about myself because I look like that. It's not, oh, I should be looking like that. It's also legal, ad-free and virus-free. So it's a safe platform for you to express yourself sexually and to feel sexually liberated. There's also the Cheeks Pleasure Academy, where there's educational workshops, videos, podcasts by experts and journalists to talk about intimacy, sex and pleasure if you want to learn more about that. And with the code Keelan07 you can get a 7-day free trial when you click the yearly subscription. I fucking love Cheeks. It's also aesthetically beautiful. I love the way the website's laid out. It's not scary at all. There's something on there for everyone. You can learn so much. It's been really helpful as well if you have difficulty like getting your libido back after you give birth or for breastfeeding. It's like it takes a little bit more to be aroused. Even if you are in a committed, loving, affectionate relationship, you need something else to keep you going. So I love Cheeks. I've been loving using Cheeks. I loved using it when I was single as well. It's good for couples if you're single, if you want to explore your sexuality, if you want to learn something about your sexuality or intimacy, or from the Pleasure Academy, because that's something that's not offered in sex education, especially in Ireland. Like, there's no way they're going to be talking about female pleasure. So if you want to learn more about that, click the link in the description. It's Keelan07 for a 7-day free trial. Sexually transmitted infections, general STI information, STI prevention. I think people are good on STI prevention. We all know the only thing is going to prevent an STI is either abstinence or condoms. The human papilloma virus, HPV, and that's if you're pregnant, you'll know all about it because you get tested for it every time you go into the hospital. Herpes, HSV, and how it can be transmitted. Something I only found out in my adulthood is that if someone has a cold sore and gives you head, you can get genital herpes from that. I didn't know that until it actually happened to someone that I know. So do be conscious of that. I've never gotten a cold sore, thank God, but I have gotten a yeast infection in my mouth after I gave birth. The cracked corners of the mouth. And I know stress is a huge cause. It affects your body so much as well, and how it expels that energy and how it expels stress is sometimes in sickness. So I got a yeast infection in my mouth when I first started breastfeeding, and that's why I actually started eating meat again. And when I went in to go see my doctor, it was so sore. But now I think my health is getting back to normal, so I'm trying to reduce the amount of meat in my diet again and just kind of having a bit of fish here and there. Now when I was in Paris, I obviously went cray cray. I ate fucking beef tartare. Like, that's real meat eater shit. It was horrible though. And then gonorrhea and chlamydia, they're really important to get tested for, because if a vulva owner has gonorrhea or chlamydia, the symptoms can go unnoticed, and it also can affect your fertility. So that's why it's really important to get tested for those two. Another one on pubic lice. She did say shaving and waxing, the only thing it prevents is contracting pubic lice or crabs. Now the only time I knew about crabs was, you know, that episode of Sex and the City where they all go to the Hamptons. Charlotte is having sex with that like 20-year-old, and then she gets crabs off him.
I need tick on my stomach and I can't get it off.
Ooh, does that hurt?
No, but it itches.
Oh my God, that is not a tick.
What is it?
Well, there go our shitty sheets.
Oh my God, so disgusting.
Where's she going?
To the drugstore. Charlotte really is in her 20s. She's got crabs. Oh my God.
Yeast, bacterial vaginosis, vulvodynia, pelvic floor spasm, and vaginismus. So I know that was a huge issue for people. Skin conditions, UTIs and bladder pain syndrome, pelvic organ prolapse. I've heard of this, of someone's uterus prolapsing. I'm not going to talk about it actually because it would just scare people. Communicating with your provider. This is like a huge thing because, like I talked about at the start of the video, a lot of GPs are uneducated and, you know, have stigmas against women about their health. In the fucking Middle Ages, during the witch trials, the majority of women that were killed were midwives because they were offering help with contraception and menstrual issues. I have pain with sex, I have vaginitis, I have a vulvar itch, I have vulvar pain, I have an odor, I have bleeding after sex. And then putting it all together, medicine cabinet rehab, internet hygiene and apps, journal of old wives' tales. So this is a really good informative book. This is the only one I would really recommend getting. It was my favorite read because she's funny and charismatic, so it was just enjoyable. I'm gonna reread it again. Okay, next question. Oh yeah, I loved this question. Any ways of exploring your sexuality that don't involve sex? Feel so lost at the moment. Because I wasn't able to have sex for a very long time because my vagina was cut open, and I didn't even realize that this was an issue for me, because I thought that I was, you know, you just think you're sexually liberated because you don't have like traumas attached to sex anymore. So I thought that I was fully healed and that I was well versed in like my own sexuality. But then once I wasn't actually able to have sex, I realized that I relied on that a huge amount in my relationship to express love and to feel validated as well, which was a huge thing. So if I was feeling beautiful or sexy, obviously your partner would be sexually attracted to you, and it could end in sex. If you're lying in bed and you're holding hands, if you're dry humping or whatever, and it leads to sex, you're like, that's a validation in a way where I feel loved, I feel sexy, I feel wanted, I feel desired. But because I couldn't do that, and also another thing is that I couldn't pleasure my partner, I couldn't offer that for him, so I was immediately going to insecurities and being like, you know, he's going to lose interest in me because I can't offer this to him. Obviously Jason fucking didn't care at all. He's like the most supportive, best partner ever. That's what we jump to immediately, that we can't offer anything anymore. I think especially as women, we find a lot of value and worth in like our sexual offerings, or like being sexy, or pleasuring other people, because that's what we're told to do, or like that's how we're supposed to be good partners. Instead of that, to try express intimacy, especially because Jason's love language is physical touch as well. And I found that when I was from breastfeeding, I was experiencing a lot of touch fatigue, because obviously I was breastfeeding. When you, in the first 3 months as well, you're breastfeeding all day. It's like you're holding a baby, you're offering love and affection, but then at a certain point you're like, I want to be left alone. So it was hard for me to express affection, or like go to someone, or even cuddle into someone. I wanted to be left alone. So a good way for me to express this and to express intimacy was to do tantric hugging. And this is something we did practice before I ever even got pregnant, and it was just easier because we had a lot more time to do it. But now obviously we have to like schedule it in, and it's especially a good tool if, say, you went through a stage of bickering or fighting. What I do is we're sitting on the bed and I wrap my legs around him, and then you just hug for 5 minutes, and knowing that it's just a hug and that it's not going to lead to anything more gets rid of the pressure of it. It's a good way to like feel intimate with your partner, and there's no pressure attached to it. Another way is just obviously making out. It was hard for me to communicate it, because I know from couples, if you have like a differing libido, it's hard to explain to your partner that you don't want to have sex as much as them, or that without it sounding like you're not sexually attracted to them. It's unfortunate that is attached, that they're not mutually exclusive, because sometimes your body, it just isn't computing. You just don't want to have sex as much as your partner. Like there could be a lot of factors affecting that, like if you're on the contraception pill, or your diet, or how much sleep you're getting, or stress, or just your energy levels. So I found that once I communicated that like my body is not computing, I can't have sex as much as I would like to, because in my head I want to have sex but my body doesn't. So we would just have makeout sessions, again with the no pressure of having sex. It would be like, let's make out and then go to sleep. Like that's what we would do, and cuddle and stuff like that. It's so innocent because it makes you feel like you're a teenager again. Once you are ready, your body will be so happy once you're not forcing yourself to have sex, and once you're actually able to, it's a lot more enjoyable rather than forcing yourself to do something that you don't want to. But if you are single, and one thing that I loved doing when either if me and Jason were long distance, or if I wasn't in a relationship at the time, is to just like spend more time in your naked body. I know it can be hard if it's cold outside, but like sleeping naked, taking a bath and moisturizing yourself, looking at your body in the mirror. It's just knowing your body is a good way to get in tune with yourself and your sexuality. Vaginismus. Probably the most common question. A really good person to follow is Grania Byrne. She contacted me before to share a poll on my story about vaginismus. I have people close to me who's experienced vaginismus. I've experienced a bit of, what's it called, vaginal dyspareunia. It's basically the same thing. But a lot of what is affecting vaginismus is vaginal dryness, stress. So the pelvic floor is basically shut. It's like this, squeezed shut from trauma. Yeah, your body is just basically rejecting anything going in there. I have seen on comments that people have left under my videos that have suffered with vaginismus. A thing that has helped them is CBD suppositories. So this is what Jen Gunter has to say about vaginismus. Think of a clenched fist. PFMS is your fist clenched all or most of the time, and vaginismus is clenching only when someone tries to shake your hand. PFMS is understudied. For many years, medicine did not emphasize this as a pain condition. Many doctors ignored the muscle spasm that was obvious on an exam, or were not taught to recognize it as abnormal. Others were taught this was a psychiatric problem or a woman just being unable to relax. PFMS is also rarely discussed publicly, so when I diagnose a woman with PFMS or vaginismus, it does not surprise me that she has never heard of it before. How do you get PFMS? There are two main categories of PFMS: spasms that seem to have present from the very first attempt at penetration, and spasm that developed sometime later, after pain-free vaginal penetration. This could be intercourse, finger play, or tampon use, etc. Some theories regarding that cause of PFMS include the following: aversive sexual messaging, a belief that sex will hurt, sex is shameful, or something that one does only for procreation. Painful medical experiences, pain primes the nervous system for more pain. Part of this is a result of microscopic changes to the nervous nervous system, and part is anticipation. This does not mean it is in your head. Pain is assembled by the brain, and emotions or responses such as fear or anxiety change the chemical signaling and the pain experience. Painful consensual sexual experiences, medical procedures / surgery, chronic constipation, other pelvic pain syndromes, previous sexual trauma, that's an obvious one. Symptoms of PFMS: vaginal pain, present some or all of the time, pain with sexual penetration, painful periods, feeling too tight, feeling a roadblock, painful orgasm, a sensation of arousal, inability to use tampons or menstrual cups comfortably, constipation, urinary hesitancy, pain during pelvic exams and or pap smears. Treatment options: there are a variety of considerations, and what works for you may be dependent on what is available locally and what you are comfortable with. Vaginal dilators help desensitize the nerves and muscles. Grania Byrne did send me an email on information with postpartum tightness, and she sent me an article which I will link down below, which is a treatment for it, but it does advertise these vaginal dilators on it. Vaginal dilators help desensitize the nerves and muscles. You proceed at your own pace in your bedroom with no pressure. They come in sets of 4 or 5. You start with the smallest, inserting as far as you can go and stopping when you feel pain, and then holding it in place for 5 minutes. Focus on slow, deep breaths to help relax your pelvic floor. Some dilators are vibrating, and many women find that helpful. Dilator exercises depend on forming muscle memory. It is important to do them 5 to 10 minutes a day, every day, than 30 minutes once a week. Pelvic floor physical therapy can be very helpful. These are specialized physical therapists with advanced training. There are a variety of techniques. For women who cannot tolerate any insertion, the therapy should start externally. Some use biofeedback machines that give a visual representation of the muscle spasm on a computer screen. This can be a helpful aid for some women. A pelvic floor physical therapist will eventually work with her gloved fingers inside your vagina and should prescribe a home exercise regimen. There are some bodywork practitioners who claim to treat PFMS, but I would advise against seeing anyone who is not a physical therapist certified by APTA, American Physical, well, this is American, yeah. Working with a psychologist to address trauma, anxiety, and any relationship issues may be part of the treatment plan. This doesn't mean that your pain is in your head, it means that pain affects your life. Addressing this impact can help reduce suffering. Women who have extreme anxiety responses to the thought of or attempts at any penetration may find working with a therapist especially helpful. Managing constipation if you are overworking your pelvic floor muscles is also important. A straining will feed the cycle of spasm. Another option is botulinum toxic injections. Oh my god, Botox for the vagina. I know that for clenching your jaw, you can get Botox in your jaw, so maybe it works in the same way. Oh my god. Mechanism of action. While approved by the FDA for some types of muscle spasm, it is not FDA approved for PFMS. For some women, botulinum toxin injections can help break the cycle of pain and spasm. The medication wears off after 10 to 12 weeks, and so this is most effective when combined with dilators and physical therapy. Oral muscle relaxants are largely ineffective. Some people advocate for vaginal diazepam, which is Valium. However, 2 studies show that it is ineffective. Diazepam works on the spinal cord and brain. There are no receptors for the medication vaginally, so if any benefit is felt, it is because the medication is absorbed into the bloodstream, which negates the point of using it vaginally. Remedies for persistent BV yeast infections. So, your vagina has natural bacteria in it, which are self-cleaning. So these bacteria basically eat away at anything that is foreign in the vagina. So if anything comes in that they're like, abort, get this out of the vagina right now, they'll eat it up and then it will come out as discharge. Discharge is a sign that your vagina is self-cleaning. If your discharge is abnormal in any way, this is a sign that there is either too much of a certain bacteria, and it could be a sign that you have BV or thrush. Discharge, which are also known as natural antibiotics in the body, they can protect you against STIs. They keep itself clean, and it's usually white, yellow, grey or clear. If it's white, yellow, green, but with a cottage cheese-like consistency, it may be thrush. Don't self-diagnose yourself with thrush because it could be something more serious. Thrush is an imbalance of the vagina's natural yeast. Something that can affect you getting BV is smoking, because it affects the pH balance of your body and can throw off the pH balance and the chemistry of your vagina, which can cause bacterial vaginosis. So unfortunately, if you are a smoker and you are experiencing thrush or BV, try to cut down on the smoking. Another thing that can affect it is alcohol, cotton underwear, which is actually very, very hard to find. A lot of underwear has polyester in it, nylon, which are not breathable fabrics, and is keeping in all the sweat and moisture, which can create a yeast infection or bacterial vaginosis. The same way in if you go swimming and then you're sitting out in the damp cold, that's another thing that causes yeast infection or thrush. We're all told as children if you go swimming to get changed immediately, don't sit in your wet clothes. It's the same thing with your underwear. I also only figured out as an adult that you're not supposed to sleep with underwear on. You're supposed to let your vagina breathe. So wear loose cotton tracksuit bottoms or like loose cotton boxers. But you're also more likely to get thrush if you're pregnant because your hormones are different. If you have diabetes, a weakened immune system, so your immune system can be weakened from stress as well, so have a look at your stress levels. If you take antibiotics, if you take birth control with high levels of estrogen, if you use douches or vaginal sprays. This whole industry of vagina deodorants and washes, they are so bad for your vagina and affect the pH levels of your vagina. It is literally a scam, so do not use any of these. If a man or a boy has ever told you that your vagina stinks or that you need to clean it out, do not ever douche your vagina. I did this as well when I was a younger teenager, you know, like putting the hose up to clean out your vagina. The bacteria in there is literally self-cleaning. You do not need to douche and can actually increase your risk of getting thrush and bacterial vaginosis. So do not douche your vagina. There is literally no need to do that. Avoid hot tubs and really hot baths. Change out of your wet clothes. Change sanitary products regularly. Add good bacteria to your diet, such as yogurt, kimchi and kombucha. Any opinions on laser hair removal? I don't know what the effects are of getting laser hair removal. I just know that it's a laser, so it can't be good. Like, there's no way that that's good for you. I did get laser hair removal on my vagina once. I actually bought 12 sessions because after lockdown they had a deal on, because obviously businesses were, you know, suffering because of lockdown, and you couldn't get your hair laser removed during lockdown. So once they opened back up again, they were like had deals on. So me and my friend Ash, we both got 12 sessions of laser hair removal. I went in for my first round. Couldn't have any tan on and you had to be completely shaved, and already I was bad at shaving because I was only trimming down there. I don't know why I thought this was a good idea. I went in and they bring you into a little room and they're telling you, oh, it's going to be a little bit painful. And then they were like, oh, you have loads of tattoos, you should be grand. And I never find tattoos painful at all. As soon as they fucking turned on you have to strip down there, get your legs spread open, you know, like this, with your feet together, spread open. It's really vulnerable. Once the machine started going, it is probably the worst pain I've ever experienced. I'd say that was more painful than, I might be being a bit dramatic, but I think the laser hair removal on my vagina was worse pain than my contractions when I was in labor. Now the pain is very different. It's like the pain of a contraction is like a dull pain, whereas the pain of the laser hair removal was like a spicy pain, like a sharp spicy pain. I cried the whole way home in the dart and I was waddling home. It was really sore. You also get this horrible like cystic acne after you get your hair lasered off. Now when I did get that one session, I didn't grow hair I didn't grow any hair back there for probably 3 months, and when I did there was like 5 or 6 hairs, so I barely needed to shave it. Now it's like back to normal. Now this was 2 or 3 years ago when I got it. I never went back for another session because it was too sore. Read this book if you have a vagina. Love you.